If you're enjoying this Med Prep to Go Step 1 podcast, you can now get the content along with the content of the Crush Step 1 podcast ad-free in one bundle. Just go to medprep2go.com and find our new subscription podcast called Med Prep to Go Step 1 Bundle.
Every who down in Who Newville liked the holidays a ton, but where to get great prices on gifts, they had no idea. None. They searched and they searched for great gifts under $25. Gifts for spouses and friends and even their toddlers. When suddenly one who shouted, Walmart has what you want, knowing they have Lego, Tree Hut, and low prices to flaunt. So they enjoy the holiday season as who's often do. Cheering and shouting, Walmart has incredible gifts. Who knew? Find gifts they'll love under $25 at Walmart.
Oh, Hilton stay, your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, a holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
Hey, this is Bill Simmons from the Bill Simmons Podcast, here to tell you that Michelob Ultra, the official beer partner of the NBA, is bringing NBA fans closer than ever this season with chances to win great prizes, including courtside tickets. Enter now at michelobultra.com/courtside. Michelob Ultra Courtside 25 to 26. No purchase necessary. Open to U.S. residents 21 plus. Begins on October 1st, 2025 and ends on June 30th, 2026. Multiple entry periods. See official rules at michelobultra.com/courtside for free entry deadlines, prizes, and details.
Hi, I'm Dr. Raj, and today this is going to be another episode on the Med Prep to Go podcast. So I'm going to be reviewing 3 USMLE Step 1 questions. And today, the questions are going to be from microbiology. So I got to tell you, I am fired up. But for more questions, go to our website. That's www.medprep2go.com. It's a free audio and online question bank. And if you want to learn more about me, Dr. Raj, well, check out my website, which is beyondthepearls.net. Check out my podcast, which is going to be Beyond the Pearls. What a surprise. Check me out on all the social media platforms. I would love for you folks to reach out to me. And I got some books. I got lots of books. I got the Morning Report Beyond the Pearls book series for clinical. That's step 2 and 3. And I got the case reports Beyond the Pearls, which is going to be for the basic science, which is going to be for step 1. So check them out. So let's start reading some questions, okay? So the first microbiome question is: a 14-year-old boy presents to the emergency department by ambulance complaining of significant chest pain. I got to tell you, 14-year-old boy, chest pain, I'll tell you what it's not going to be. It's not going to be acute coronary syndrome. I don't think the atherosclerosis built up just yet. But you definitely got to think about, how are they going to describe the chest pain? Is it pleuritic? Is it reproducible? Is there fevers? So I'm sorry, I talk too much. Let me go back. He reports that the pain started suddenly 1 hour ago and is exacerbated by taking deep breaths. So it's definitely going to be pleuritic in nature. It's acute in nature. He describes it as a diffuse ache throughout the chest and rates it, 8 out of 10 in severity. He has a history of sickle cell disease and describes a long history of transient joint pains, usually in his fingers. He is unsure of his immunization status. I'm sure the kid is, but they should ask the parents. Vital signs are, temperature is 101.5. So we got fevers, we got sickle cell, we got pleuritic chest pain. Something going on where? In the chest. And if I say sickle cell and chest, what syndrome? Oh man, you folks are awesome. Some kind of acute chest syndrome. Well, let's see where this is going. Blood pressure is 140/90, heart rate of 120. Respiratory rates are tachypnic at 24. Physical exam reveals conjunctival pallor, so definitely anemic. Tachycardia, normal heart sounds, and wheezes in the posterior right chest. And they do a chest x-ray and they show a consolidation in the right lower lobe. So definitely we think about what? Pneumonia. Probably a bacterial pneumonia, probably a community-acquired pneumonia. We'll see what happens. And are people with sickle cell disease, are they predisposed to infections? Are they immunocompromised? Totally. And what's one of the main reasons why? Yeah, some kind of like a functional asplenism, like they really don't have a spleen, even though it's there because they have sickle cell. So, of course, this patient has a higher susceptibility to infection with which of the following pathogens? Oh my God, this is a tough question. It's A, acid-fast rods, B, gram-negative comma-shaped bacilli, C, gram-negative diplococci, D, gram-positive catalase-positive cocci, E, gram-positive obligate anaerobic bacilli. That's a tricky one. Man, good job, question writer. I'm super proud of you. And the right answer here is going to be C. It's going to be gram-negative diplococci. This is a patient of acute chest syndrome in someone with a known history of sickle cell disease. The presence of acute onset of chest pain, fevers, wheezing, consolidation, and definitely are parts of the criteria suggestive of acute chest syndrome. A feared complication of sickle cell disease is caused by vasoocclusion of the sickling red cells. Patient with sickle cell disease become functionally asplenic, called it in childhood. Individuals with functional or anatomic no spleen, asplenia, are at higher risk of infections by encapsulated bacteria because they do not possess a spleen capable of clearing encapsulated bacteria from the bloodstream. So I remember when I took Step 1 or when I'm teaching Step 1 review courses, there's always these acronyms, right? And one of them is to remember the encapsulated organisms. It's some killers have very nice capsules. I hope I said that right. And S for some, and that would be streptococci, killers for Klebsiella, and for Neisseria, why this is going to be the gram-negative diplococci. Man, Cryptococcus for capsules. Man, make me go through all of them. But anyways, so that's why C was the right answer because of Neisseria. I don't think that's causing the pneumonia per se. You know what I mean? I think that's probably going to be a community-acquired pneumonia you want to cover for things like strep for sure. But choice A, acid-fast rods, is incorrect. This describes mycobacterium, which are not encapsulated. B is gram-negative comma-shaped bacilli is incorrect. This describes Campylobacter, which is not encapsulated. D, gram-positive catalase-positive cocci is incorrect. This describes Staphylococcal species, which are not encapsulated. And E, gram-positive obligate anaerobic bacilli is incorrect. This describes some of the Clostridium species, which are also not encapsulated. So learning point is patients with sickle cell disease become functionally asplenic in early childhood, making them more susceptible to serious infections and encapsulated bacteria. Definitely things you want to consider in someone with acute chest syndrome. I'm just going to go freestyle. You know me, I love freestyling. You want to think about a red blood cell exchange transfusion in some of these cases. Remember that you don't want these individuals to be hypoxic. They commonly develop this because of pain. They have atelectasis, making hypoxia worse, making the sickling worse. So it's really hard. You definitely want to control their pain. They're in a lot of pain in these patients. So my heart definitely goes out to sickle patients. I take care of a lot of them in the medical ICU if they end up going there. And this is a high yield question on the boards. So next one. A 4-month-old infant is brought to the emergency department by his mother for progressive muscular weakness and failure to thrive. The mother reports that her mother-in-law recommended mixing honey with formula to improve consumption of formula when fed through the bottle. Stop right there. I got to do a side note. Are there red flags in this vignette? Yeah, I'm thinking of a child that's 4 months old who's eating honey. I mean, can you say the B word? Yeah, botulism. Let me see where this is going. But I mean, I don't recommend that at all. And we have to give a lecture to that mother-in-law for those recommendations. The infant is admitted to the hospital. Antitoxin is administered, and a diagnosis of infant botulism is confirmed. By identification of toxin in the stool. All right. The infant is given supportive care and eventually discharged from the hospital after a prolonged stay. I feel so bad. Did he get floppy baby syndrome? Which of the following describes the causative organism? Oh man, this is tough. Is it A, gram-negative coccus? B, is it a gram-negative rod? C, is it a gram-positive acid-fast bacterium? Is it D, a gram-positive coccus? or E, a gram-positive rod. So you just got to know what is Clostridium species, and we talk about Clostridium species. Those are triple star high yield for the board exams. And of course, right off the bat, if they have bad wounds, you think of Clostridium perfringens, antibiotic use, and diarrhea, Clostridium difficile, of course, tetanus, and of course, botulism. You know what I mean? So the right answer here is, did you memorize it out? It's a gram-positive rod. E is the correct answer. Infant botulism, also known as, stole my thunder, floppy baby syndrome, presents with GI upset and proceeds to a descending flaccid paralysis due to botulism toxin produced by the spore-forming gram-positive rod Clostridium botulinum. Clostridium botulinum is ubiquitous and is easily spread from surfaces of fruits and vegetables and exists in soil and marine sediment. Spores thrive in anaerobic environments, such as canned foods, and release neurotoxin, which is then consumed. Spores can also be released from the soil by construction work. In infants, spores germinate into the GI tract, releasing neurotoxin from there and causing a floppy baby syndrome. The heat labile toxin blocks the release of acetylcholine at the neuromuscular junction, leading to an inability to create the required action potential. That's a really important sentence for the boards. Treatment involves giving the antitoxin and supportive care. Sometimes intubation with mechanical ventilation is necessary, which is true and very sad. The adult GI flora is resistant to Clostridium botulism colonization, but the microbe may colonize wounds, called wound botulism, and release toxin, leading to a flaccid paralysis, especially of the cranial nerves. So the learning point here is that Clostridium botulinum is a spore-forming gram-positive rod, which causes infant botulism.
When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite. Obey your thirst.
This episode is brought to you by Indeed. You're ready to move your business forward, but first, you need to find the right team. Start your search with Indeed-sponsored jobs. It can help you reach qualified candidates fast, ensuring your listing is the first one they see. According to Indeed data, sponsored jobs are 90% more likely to report a hire than non-sponsored jobs. See the results for yourself. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
And let's do one more. 31-year-old woman presents to the emergency department with fever for the past 2 days and a burning sensation while urinating over the past few weeks. She reports having unprotected sex with multiple partners over the past 6 months. Past medical history is significant for eczema and asthma. She does not currently take any meds. Vital signs, she has a low grade at 100.2 Fahrenheit. Blood pressure is 118/74. Heart rate is 94. Respiratory rate is 16. On physical examination, purulent cervical discharge is evident, and cervical motion tenderness is also noted. Which of the following is the most appropriate investigation for definitive diagnosis of the most likely etiology of this patient's symptoms? All right, so the choices are A, dark field microscopy, B, Gemsa stain and microscopy, C, Gram staining followed by culture, D, nucleic acid amplification testing, or E, serological testing for antibodies. So what is the question asking? Do you know what organism is causing this patient's symptoms and causing that purulent cervical discharge? And if so, if you wanted to grow it or identify it, how would you do it? And it seems like there's Gram stains, there's cultures, there's antibodies. So let's see. The correct answer here is going to be D, nucleic acid amplification testing. So the most common cause of organism of sexually transmitted infections, STI, in the United States is Chlamydia trachomatis, the D-K subtypes. It causes urethritis. It can also present as in this patient with dysuria, as well as fever, cervicitis, which is manifested by purulent cervical discharge and cervical motion tenderness. This patient is at risk for pelvic inflammatory disease. I believe there's something called the chandelier sign. When they do the exam, it's almost like they're raising their hands in pain to the chandelier. There's salpingitis that can lead to an ectopic pregnancy later in life, which is really sad. Endometriosis, among many other conditions. Chlamydia are atypical organisms that cannot be stained using a regular gram stain, which is why gram stain was the wrong answer, due to the lack of a typical peptidoglycan layer. So therefore, a polymerase chain reaction PCR or a nucleic acid amplification testing, NAAT, is a diagnostic investigation of choice. Choice A, dark field microscopy, is incorrect. Dark field microscopy is most commonly done on samples from a painless syphilitic sore, a lesion that marks the onset of stage 1. B, Gemsa stain in microscopy is incorrect. Gemsa stain can be used to stain chlamydial organisms, but it is not the investigation of choice. Choice C, gram stain followed by culture, is incorrect. Atypical organisms like chlamydia, rickettsia, legionella, among others, just to name a few, do not gram stain well due to the atypical peptidoglycan layer that contains much less muramic acid. And E, serological testing for antibodies is incorrect. Serological testing for antigens or antibodies is not done for chlamydia. So what is the learning point here? The investigation of choice for the diagnosis of chlamydia infections is nucleic acid amplification testing, NAAT, or doing a PCR. And I hope everyone enjoyed this walkthrough of 3 high-yield microbiology questions for your USMLE Step 1. And to get more questions, check out our website, which is www.medprep2go.com. I'm Dr. Raj. See you again for more questions.
Hi, everyone. This is Ted O'Connell. I just want to let you know that we have launched a Step 2 QBank podcast, very similar to our Step 1 QBank podcast. Each episode will have 3 questions so that you can study on the go. We are actively recording these and plan to release a new episode every 2 weeks. We're also launching a premium podcast bundle that will include ad-free access to USMLE Step 2 Secrets podcast, as well as early and ad-free access to all of our episodes from the Step 2 QBank podcast. So please go over to our website at medprep2go.com and check these out, or you can access them wherever you get your podcasts. Thanks so much.